Look at that diastema, bro.
Dude, can you see it?
Dude, it looks nice and straight. And your cheekbones are insane, man. You're looking like Ben Askren.
uh, that's part of it. That part of the talk I wanted to have with you was how much I've noticed just the mid-facial benefits. And I had an appointment yesterday with Dr. Evans, a checkup, and we did my first CBCT since the original one. And I'm just gonna pull up my photos here. I have a,
Okay,
a picture of the split, and it's perfect. I would love to share it with you.
please do. Yeah, you should be able to screen share. And maybe just remind me, when was the MARPE placed? How old is this old CBCT? How long have you been expanding? How many turns have you done? Maybe just lay some groundwork for me so I can know what we're looking at.
Of course. So while I'm pulling up, I'll go ahead and talk. I have probably been turning for about 30 turns, a little bit more. I haven't been keeping track just because in the beginning I had some bleeding complications. I had my MARPE placed on October 1st. So
Okay.
it's been a
With
little.
Dr. Marianna Evans.
Dr. Marianna Evans, and huge shout out to you, man, for pointing me in her direction, because I believe the quote in our original, the thing you said, the sensei appears in your backyard when you need it most, and something like that. And you were so right, man. I mean, I had my consultation with her. I was like, wow, this stuff's expensive. But you prepped me for that. We talked about cost and everything, but paying myself for it myself out of pocket, it was definitely a big consideration.
How much was it with Dr. Evans, if you're okay sharing, or maybe give us a ballpark?
Yeah, of course. So the MARPE itself, to get it placed, was 5K. So just to have it put in, I guess you do that in 2 payments, I believe, but um and she was willing to structure it in a way I was comfortable with. But again, I wanted to just do what's best and not be one of those patients who leaves a balance and stuff. So I paid the 2 payments up front to have the MARPE placed, and I believe it'll be another 8 to 10K for the course, like the orthodontics afterward.
Okay, so yeah, we're talking a $12 to $15,000 total treatment plan.
Yes, sir.
Maybe factor in travel, et cetera, et cetera. Let's call it a 12 to like 16K. And yeah, because people are interested in now cost of like high level custom MARPE, would say someone like Dr. Mariana Evans or someone like Dr. Lipkin,
Mhm.
um, versus, of course, people are thinking in terms of FME and the cost of that, which tends to be closer to 25 to 30K for expansion plus post expansion ortho. And maybe that's a rough ballpark too. Maybe it's something like 23 to 30 or something. But yeah, clearly there's a difference. Clearly
Huge
there's a
difference.
difference.
And I think I was only comfortable with paying that big upfront cost, or which seems like a lot to a 22-year-old, fresh out of college with no money. So when you throw these numbers around, I mean, it's a lot. But saved up, I lucky enough to get a job straight out of college. So I've been working, and a lot of it's going all to the MARPE. But as you
Is
said,
the OnlyFans taking off?
yeah, I know. But only maybe after the Marpy's place. Real quick, Ron, and this is on me. My permissions for Google Chrome wasn't turned on
Oh
for
yeah, just
screen
jump
streaming.
out, let the permissions set, and then come right back in. The link is live.
Appreciate it. Cool. Yeah. Thank you for taking a second. Ron, here
Of course.
I can pull up my so this X-ray that was taken yesterday, and share my screen. I was pretty sure I split um 2 weeks ago now,
Okay.
because of all the pain and sensitivity in the front teeth. Sorry, here, I'm just
No, that's okay.
software.
I'm also messing with my browser too, trying to get the there it is at the stage. Okay. All right. The screen share is live. It's part of the stream.
Awesome. So, yes,
Hmm.
this is
Hmm.
my split from confirmed split. So, I did make a video on my channel when I thought I was splitting and I was seeing the diastema and really feeling the front teeth sensitivity, but it was awesome. I've been begging to get another X-ray, honestly, just to see the expansion. And it was
So where was this compared to where you're at now?
so this was yesterday.
Oh, this is a fresh scan?
Fresh scan. This is
And can we see
yesterday.
what this diastema looks like in real life?
Yep.
Can you show us? Hold on a sec. Uh, yeah, man,
Yeah.
StreamYard is bugging out. But let me let do that one more time, please, Cannon.
Yeah, of course.
Okay, and let me actually even do this. Maximize. Let's see.
It just keeps
Yeah,
getting
let's do now do it. I'm sorry. Well, and I'll clean that up in the edit. Yeah. Yeah. Okay, let's see where's the midline falling. Can you bite down so I can see where that diastema is with respect to your lower midline? And so the midline is a little funny right now. Put your thumbnail between your two lower front teeth for me. Yeah. So it looks like so now it looks okay, but why was your mandible swinging to the left earlier?
that is just how my bite is falling right now. So,
Yeah. Pretty common.
and that was one thing I didn't want to bring up, and I'm glad you saw it right away. My question is for you. Once, um, and by the way, I have a permanent bottom retainer, hard to see, with enormous glue bumps that my past orthodontist didn't do me any favors installing. Horrible permanent retainer down there, and it honestly affects my speech even before I got the MARPE.
Mhm.
I'm wondering if when that releases, if my mandible will kind of swing, or if this is kind of keeping everything locked into place right now.
Yeah, let me see what the total expansion looks like. That way I can maybe comment on the orthodontic road ahead for you. So
Sure.
open wide and show me the upper. Wow, yeah. Holy smokes. Look at that MARPE. That is a custom MARPE if I've ever seen one. How many TADs do you know?
6 tads.
Okay, and now bite down. Hmm. Is your expansion maybe going a little to the right? Is it a little more to the right than the left?
Oh yeah,
Show me that again.
definitely noticing.
Are you feeling that in your bite? Uh,
If taking the headphones off is any better.
yeah, take the headphones off and then actually lean your head back. I want to see if I can see that in the cheekbones too.
Sure.
Go like this so I can
I'm
see the
trying to hear you,
cheekbones.
but
Yeah, lean back. Yeah, that right cheekbone is looking a little more bumpy than the left. Put the
mhm.
headphones back on. Yeah, nice studio monitors, by the way.
Thank you, man. That my aunt, shout out to her. She worked at NBC 10, snagged me these on her way out.
That's what's up.
Yeah, love these things.
Dude, first of all, the boniness of your face is just gnarly. It's just gnarly. I feel like I forget what you looked like when we first talked,
Yeah,
but
let
you
me
have some
actually.
serious like angulation going on.
I'm not so I know it's a big thing. Like, are people gonna like the look of Marpy afterwards? I think I love. So here is. I'm pulling up right now. That is that was me
Let, yep.
probably. Sorry.
No, you're good. Keep going. I gotta.
Okay. So that was me probably right around
You got a little infinite scroll going. Can you open that in preview and maximize it?
oh yeah, of course. We got a little schoolwork on there, but there we go.
That was you before.
This was me before the Marpy, and no, and after getting my wisdom teeth out. So I did get my wisdom teeth out 2 years ago, and right around then is when I found your channel and found that classic JawHacks clip of you mentioning the wisdom teeth being the pillars of your whole facial structure, and I related so much to that. because I felt like I was crazy for noticing facial changes after my wisdom teeth. I noticed my face was more chubby, it seemed, even though I was around the same weight. I was holding more water, and even some maybe, I guess, recession, or I'm not sure if that's the proper term, but in my mandible and maybe overall mid-face area. Um, yeah.
Yeah, you definitely had a lot of bony potential in your face before, though. I mean, yeah, strong eyebrow ridges, even cheekbones that were sort of already a little popped, sort of a sharp jawline.
I
Um,
I did note, so Dr. Evans pointed out too, right there was a little bit of the, pre-existing asymmetry, she called it, because
100%.
I did point out, it 2 weeks in a row or 2 appointments in a row that I was noticing um, it seemed like popping out on this side, and, of course, I don't wanna be balloon-faced or anything like that, and I'm doing this, probably a lot more for the breathing benefits and sleep benefits and headache benefits than the aesthetics, and it seems so far that the aesthetics is just a nice bonus.
Yeah, and how has the breathing benefit been for you?
So it's been amazing, Ron. I mean, I feel like, and I wanna make a compilation from all the clips on my channel because I have install, a video of my install right after, all the way through, recent of each video. In the beginning, I do an inhale, so I would say it was almost 24/7 seasonal allergies before getting the MARPE, and it was right around when I was splitting and noticing that sensitivity and pain. It felt like I got sick and maybe just a little cold or seasonal virus or something. But Ron, it was the first time since I was a kid that I can remember my sinuses draining, and it was the craziest feeling. So my whole sinuses were draining, and accompanied by nosebleeds. I get them anyway when seasons change, but I think just because my airways opened up and it's drying out my nose even more.
Mhm.
But I noticed a huge difference when I was sick. Usually I'm a mouth breather when I'm sick 100%, um, especially when sleeping. It's hard to control, and you can't tape your mouth when you're congested. At least I can't. But I felt like I almost could when I had the MARPE in while I was stuffy. I mean,
Mhm.
it sounds cliche, I know, and and I've seen the before and afters of, like, that Dr. Evans puts out on her YouTube channel a few years ago of patient testimonials, and it's hard to believe that when it's so set up and looking nice with the perfect lighting and camera angles. It looks like a medical commercial, but fe
Curated, yeah.
exactly, but feeling it and being able to, like, say, "Guys, oh my gosh, it's true. The MARPE breathing is insane." I feel like I can smell again. I step
Wow.
outside and can breathe fresh air. It's not to bring up the kid stuff again, but, like, it kinda reminds me of, like, being able to breathe as a kid before, and I was showing Dr. Evans pictures, to get her opinion on my childhood development, and we definitely saw I was between the ages of 4 and 5 that my, face started going vertical, and I started having those, deficiency issues.
Wow. Wow. Are you gonna keep going with your expansion? And I know you had asked a question earlier about what's happening with the mandible, how are we gonna get the bite back together? Uh, I'm just curious because the answer to that is gonna kind of vary with, like, what your plans going forward are for continued expansion, or if you think you're happy with where you're at, I can offer my opinion on that, but where
I
where
would
do
love
you
to
think
hear your opinion, and I'll give you mine, and I'll let you know what Dr. Evans suggested too.
I mean, it doesn't look like you've actually expanded that much just in terms of pure magnitude. It looks like, well, we know 30 turns, and we know with the Tiger screw, it's roughly, I think, 7.25 turns per millimeter, or let's call it 7 turns per millimeter. So we're looking at 4 millimeters of expansion, maybe even less, because
Last
some of that may be lost into just a distortion of the appliance, et cetera, et cetera.
So
Um,
when she measured
yeah.
it out on the CBCT yesterday, it was about 2.4 millimeters of expansion in that picture of the palate split down the middle.
Mm.
So I'm wondering if a lot of it's going into the cheekbones. And as I continue, and another thing we're watching out on, and it's something that you and Dr. Manuel had brought up in your last interview with him, that, and excuse me if I'm getting the name of the bone or the sutures wrong, but the pterygoids or pterygomaxillary,
Point to it for me. Yeah, okay.
these ones. Dr. Evans brought them up and said we're going to be watching. She wants to do 10 more turns, and I agreed to do 10 more turns and see where we're at. And she wants to get to 4 millimeters about of expansion for me.
Mm.
Um, but we're going to be constantly watching those sutures to see if one breaks before the other. She's under the impression that I will really feel the break. And while she was putting my TADs in by hand, she actually had to take breaks because my bone was too thick. She
Mm.
mentioned how thick my bone was, so I was even nervous about being able to split. But
You're a bony son of a bitch, huh?
dude, I don't know. I mean, I'm not crazy tall, but I guess all the density just went right to the maxilla or something.
Well, it's like it really reflects all over your face. I mean, your angularity is just mind blowing. I mean, the if I could draw some contours on your face, the shadowing, everything, it's almost like a cartoon. It's striking. It's really striking.
And
It's,
dude, I mean, I was self-conscious before getting the MARPE line. I mean, I will say it's been even, I'm not nowhere close to done, and I'm noticing a bit of asymmetry. And again, I know that's like the biggest thing, one of the biggest thing people worry about going in. I don't even mind it that much. It's a little bit bothersome, but all these effects in the cheekbones, like that picture I showed you before, I did not feel like I felt like right after my first Invisalign treatment, that really brought my cheekbones forward. And then being done that and going into college and then being halfway through college and getting my wisdom teeth out, I feel like that kind of wrecked my looks almost. And I don't it feels weird going a little bit into the looks hemisphere of it because I've been trying to explain to everyone else the medical benefits of it to build, but I'm glad we can go into the looks aspect 'cause that's something I haven't been able to talk about really with anyone.
well, I think that's really the most important thing for us to talk about at this point, because from a functional point of view, there's a few concerns from a functional point of view, right? Of course, there's the occlusion concern. Can we get the bite back together? I would say presently, absolutely. The bite can be brought back together just by tipping the lower teeth upright a little bit, maybe tipping the upper teeth in. You don't seem to be developing a cant, which is good. I don't see. I don't. Well, with you, if I look at you like that, look straight on with your lips closed. So lip the right side of the lip is a little lower than the left, which would be indicative potentially of a little bit of dropping of that side. So you should continue to keep an eye on that to make sure, because especially with the custom Marpies, that's the biggest concern with them, is that because the tiger screw has no stabilizing guide rods, guide barrels like the MSE Type 2 or like the FME, it's particularly prone to these types of vertical asymmetries where one side of the skull will push one side down, and then the tiger screw essentially has no way of sort of stabilizing against that. So that's very common with the custom Marpy, is that you get these sort of vertical drops on one side compared to the other, and that does tend to occur on the side that's expanding more. So, and can I just see what that looks like in the bite right now?
Yeah.
Smile. I don't see it in the bite. I'm not seeing more gum on that side. I'm not seeing a stepwise drop between your right upper incisor versus the left. So it could be a little bit of an illusion with the closed lip. It could be that pre-existing asymmetry that we were looking at before. But I would just say keep an eye on that. But and then show me your bite one more time so I can comment on the occlusion. Yeah, your left side is right there. There's going to be no issues getting the bite back together there. Let me see where your midline is when you bite like this. Hold on a sec. Yeah, now bite down with the midline centered. Bite down with the midline centered. Yeah, like that. So yeah, so okay, yeah, you're okay. You're okay. So I basically think cosmetic. So I think your biggest issue is going to be cosmetic. Like, I don't know if I want you to expand much more from a mouth closed, just looking at your bones point of view. I mean, it's already really aggressive, man. Like, I don't know how much harder we want to push that. That being said, the gains that you're getting in your breathing are just it's too gravy to
Amazing.
turn down, at least trying another couple of turns. And basically, if you don't like the way it looks, and I'm sure you and I will talk about that in the joint, and we'll do another call probably in a couple of weeks when you've done those 10 turns, and we'll reference this video. We'll have a great kind of snapshot in time of what you looked like at 30 turns. And if what you looked like at 40 turns is worse, and I'll offer my opinion at that point.
Please,
If
of
it's
course.
worse then, and if your breathing hasn't gotten remarkably better in those 10 turns, and if your bite has gotten even wonkier, and if that asymmetry has gone more on that right side and your left side is unchanged and your right side is starting to blow out, maybe we talk about turning back those 10 turns or 5 of them. But that's kind of where we're at. I think like you're at that point where, all right, let's try to squeeze out another millimeter, but we'll do so cautiously and with the option to abort if needed.
Right. And I like that I like that you're willing to keep such a close eye, man. I mean, that's awesome to have someone else other than the doctor in my corner. She wants to try to get to 4, and I'm with you where this looks pretty extreme to me, and I've had to get kinda used to it, and it's hard to get used to it being given in such a short amount of time your face changes with MARPE. But I'm wondering as we turn and maybe if we get those 2 sutures to break at the same time, I mean, there's no way of controlling it, but would that promote even more? Would that kinda relieve the outwardness pressure on here and kinda let stuff fall forward, or am I please tell me if I'm wrong in that theory.
I'm not sure I'm following that theory about the pterygomaxillary sutures potentially having some sort of release and things. I don't know if you would want that.
Sh
I don't know if you would really want. I think things are looking good. Like, you don't look like you've developed vertical maxillary excess or anything like that. You don't look like you have an excessively long mid face. I kind of love the proportions just the way they are. Like, I really personally wouldn't want to fuck with it based on what I'm seeing. So I don't know if I'm you, if I'm kind of wanting any kind of drastic sutural release anywhere.
Yeah, and I'm not sure if I do either, and I'm glad we're talking about it because Doctor Evans made it sound like if one breaks and the other doesn't, we kinda have to stop. Like you s
No doubt about that.
right, stop right
Any
there.
kind of unilateral sutural break, whether it's frontal maxillary or whether it's pterygomaxillary or anything, that's not ideal with MARPE. That's how radical asymmetries start forming.
So would you want and I'm totally, like, learning and everything, you know the most. Is the goal to have those not break? During expansion or again to have she mentioned that it would be okay to keep turning if they break at the same time. That's where I'm a little confused.
So I would say, and I could be wrong, but I would say the only suture that you really want to break during expansion is the mid palatal suture. Everything else you want to be disturbed.
Mhm.
You want to be distracted a little bit, disarticulated, stretched, whatever you want to call it. You want all the circummaxillary sutures to get disturbed so that they start to change and maybe sort of fall forward so you can get a little bit of AP. Of course, you want all that done symmetrically. You definitely don't want any of it happening more on one side than the other. But sutural breaks with MARPE or FME, I I I don't know if I would say that you ever want to break.
Got it, and
Anytime things break with MARPE, you tend to see catastrophic asymmetric uh, change on that side.
gotcha. And I might have misunderstood her wrong, but it sounded like if they both broke at the same time, it would be okay, and she almost said that I would feel it. I would feel a pop or a snap.
Hmm.
And I haven't felt anything, and she mentioned when I got it installed that I would feel the split down the middle, which I didn't, and it might have happened when I was sleeping or during a sneeze, and I just didn't realize it.
Hmm.
But, Yeah, if we can avoid anything breaking or and going to the extreme, I would like to avoid that. But would you think it'd be safe if I kept turning? She wants to go 10 more turns, turning every other day for a goal of 4 millimeters. If I'm noticing too much on one side, or it's just, it.
I would go even. I don't want to overrule her. I would. I would go really slowly.
Got it.
Okay, because I don't think you actually want to stress things out to the point that anything breaks. Because the worst thing that could happen to you at this point is that you do break one of your pterygomaxillary sutures, or that you do break one of your frontal maxillary sutures, and then you get a drop or you get a yaw on the side that breaks. If it's a frontal maxillary suture break, that side might drop. If it's a pterygomaxillary suture break, that side might pop forward and kind of,
Hmm.
yaw forward. And then, you know, I don't know if we know for sure that those sorts of things can be back turned even.
Right.
There's, Shuikai once said to me that it's not necessarily true that you have a complete return policy on a MARPE. It's often said that
Hmm,
you can just back turn a MARPE if it doesn't go right. And there's some truth to that, but I wouldn't bank on the fact that you can just turn, get some sort of unilateral suture break, have a yaw or a cant problem, a vertical drop problem from a frontal maxillary suture break, and then just turn that back, because now you're sort of trying to put Humpty Dumpty back together to some degree.
interesting. Yeah.
So I wouldn't want it to get to that point. One way you can hedge against that is to just go slow.
Nice.
And
Slower
what did
than
Dr. Evans recommend? A turn every other day?
every other day, one turn. Would
So
you?
if that's what she thinks, then I think that's reasonable. She's highly experienced. I don't think you could go wrong doing a turn every 3 days or even every 4 days. I mean, we're talking 10 turns here. So no matter how slow you go, it's like not going to amount to that much more time difference.
Right, and I probably won't get 10 turns. I mean, I'll see her in 2 weeks. I didn't get the last appointment, she said 10 turns. I think I did 6 when I got to her at yesterday's appointment. So
Mm.
she said, "Let's see another 10 turns." So
Mm-hmm.
I might not even, and I think going slow is probably for the best for, for this reason, and for the reason that I'm noticing some tooth or molar discomfort on this one side too.
Mm.
The other day, I turned and I probably should have waited to the end of the day, but I went to eat something, a little bit after, and definitely some pain, and then into the morning pain when chewing, but that subsided over the past few days, for
Yeah.
sure.
Yeah, so to me, that would indicate that you are pushing up against the pterygomaxillary area, because that pterygomaxillary area, which is sort of behind your last molars, that's the area that really resists posterior expansion. And that's why Casey Lee historically used to release that area with ease, and why other, orthognathic releases from MARPE, whether it's two pen method or ease or mind, I think they tend to release the pterygomaxillary area just because it puts up so much of a squeeze on the posterior expansion. So the fact that now maybe the appliance is starting to lean into the back teeth a little bit, and the teeth are starting to absorb a little bit of that expansion as opposed to the skeleton, you're right there on those plates.
Yeah.
That's a hunch. It's not 100%, but um, yeah, watch out. And maybe that's what she's saying. She's saying, hey, let's keep going. Let's bust through those. And if we can bust through those, then now it's kind of calm seas again for a while. But it's like, why fix what's not broken? You're breathing better. You're looking good. And I could very easily see this tipping into a place of looking too extreme.
Mhm.
I hate to be overly cautious, but like at the
No,
same time, it never hurts to be cautious in this space with these expanders. They're extremely powerful, as you've seen.
it's crazy, man. With it, titanium is what they're made of, right?
I think custom MARPEs are mostly titanium, maybe some kind of titanium alloy.
Mhm. It
I think, well, titanium is an alloy, I think so.
it is tough. Just
Yeah.
chewing and the stuff that this thing's put up with, like steak after, well, not that I eat too much steak, um, just like hard stuff in general. I was like, "Oh my god, this thing is taking a beating," where I'm like, afterwards I feel around with my tongue. I'm like, is it still there? Yeah, it's still there.
Well, that's the thing about the custom MARPE, and I hate to make this about custom MARPE versus FME,
Please, and
although
I'd
in
love to talk about it too. And if you mind me interjecting real quick, I brought up and showed your video to Dr. Evans with Dr. Manuel doing the MSE versus the custom RP versus the FME. She found it fascinating, Ron. I mean, to
Mm.
the point where she had one of her assistants go to the back and bring out a prototype FME that they had, I guess, FaceGenix had sent her, and it looked like a very old version of it, very tiny. But she showed it to me and showed me, and she actually said, I like the screw on the FME a lot. And she was supposed to be calling the lab today to talk about the screw and the stability of it. But that was all from showing her your video with Dr. Manuel.
Well, that's breaking news. Dr. Evans is considering FME. Obviously she's strongly associated with the custom MARPE, and so thanks for that. It's very interesting.
Yeah, not
But
to, I don't wanna, say
out her.
out her like that, right. But,
They're all thinking about FME, man.
yeah,
You can run, but you can't hide.
yeah, and
It's no secret. It's nothing to be ashamed of. It's just an indicator that she's interested in the latest and greatest thing. I'm sure she doesn't hold equity in
of course.
any custom MARPE labs. She's dedicated to doing the best possible thing. And I'm not even saying that FME necessarily is the best possible thing. I think it would be overstepping for me to tell Dr. Evans what she should and shouldn't be using to treat patients. But like, of course she should. She of course is going to be interested.
Oh, yeah, dude, I mean, I was surprised, like, you see and when Dr. Evans comes to my mind, like, the MARPE expert, so the fact that she was like, "Oh, I do have this FME prototypes that they sent me sitting in the back," and she took it out, and she actually expanded it in front of me, and it was really cool when we were looking at the stability there, and this was the old version, like I said, but it was really cool, and she was interested in the stability of the screw. And she mentioned, and again, I don't want to somehow out her, but she mentioned somehow incorporating that screw into a custom MARPE design, which I thought was cool. So she's like thinking about that. That's on her mind.
Yeah, and I think probably what she likes about the screw is that it's stabilized on either side with parallel guide rods or support barrels. Basically what that means is that forces coming down, especially vertical forces, seesaw forces coming down, can't just tip the guide screw because there's those locking barrels that prevent that vertical seesaw motion from occurring. And where I was going with my comment earlier when you were discussing the things you're chewing on and eating steak, it's almost not advisable with custom MARPE to do that because you're just introducing more vertical forces onto the custom MARPE and potentially pushing it past a breaking point where you could even induce asymmetry if you have asymmetric chewing forces that you put on the custom MARPE
Wow, I did
because of
not
that
know that.
dimensional instability in the vertical. Whereas because the FME has so much dimensional stability, people are doing the opposite. They're going out of their way to introduce additional forces on top of the expansion, thumb pulling and chewing and clenching and face mask via the FMA, and they're piling it on in terms of forces they're putting into the face with the MARPE during the expansion while the sutures are being disturbed. And because the FME is so dimensionally stable, all of that force seems to be, and forgive me if this is overstepping, it may be, but it seems to just be going up into the midface, into the circummaxillary sutures, and releasing things even more deeply, and leading to more advancement of the entire midface, and more expansion, and more everything in the right direction. That the expander is kind of holding things, and the expander is bracing the face into this vector of expansion. And therefore, like I said, you can just pile it on and you're just loading that vector basically, as opposed to the custom RP where you might actually alter the vector by loading it too much.
She cautioned against chewing, and watching your sit down with Dr. Oz and his the person he works with, I'm blanking on the name. I'm so sorry.
Doctors Nawaz and Jafari,
Yes,
yeah.
sir. That was an amazing interview, and mostly because he was going through the FME himself, and hearing that he was clenching and trying stuff like that. And I brought up the chewing and gum, jawline gum to Dr. Evans, and she brought up that exact point you just mentioned of not wanting to introduce forces because it could do exactly what you said.
Yeah, not to mention the fact that you have the arms coming off the appliance attaching to the teeth, and chewing gum is horrible for that.
Oh yeah.
It's probably not even really possible to comfortably chew gum because it gets caught in those arms. Although some gum is stickier than others, and jawliner gum, whether it's the jawliner brand or whether it's other brands, stronger gum, mastic gum, et cetera, they tend to be less sticky. They tend not to actually get stuck in appliances, unlike, say extra gum or pick your poison in terms of off the shelf stuff that you can get at a convenience store. Stuff is very sticky, but still, the molar arms don't help when it comes to doing anything extra in your mouth. Certainly, thumb pulling is probably harder when you have the arms because you got to find space in between them.
Yeah, and
Um,
if we could jump to that real quick,
sure.
your interview with the female doctor from Turkey, I believe.
Yes, Dr. Aisha Chamile.
Yes, I found that um, that interview was awesome, especially because she was had her own custom MARPE lab she was working with, and it's cool to see how other practices work in different countries. She mentioned almost, and I felt like I could relate directly to it while I was watching that interview because I was noticing the popping out on the side at that point. Would and she mentioned, and would like to ask you if you'd recommend doing what she advised was pushing and pulling on the other side, or if that is also like a no because that is external forces.
I don't think I would recommend that for you. I don't. I just think that uh, we don't know where we're at. We don't know where our starting point is. We don't know. It's just too unpredictable. And I think you're already headed in a good direction for the most part. I mean, so, okay, so maybe a caveat. So we do seem to think that you are maybe expanding a little bit more on the right than the left. So if maybe while you turned, and this could be totally loony, but you're right. Dr. Chamile did say it herself, so it is coming from a professional. But maybe if just while you turned, you put pressure on the left side and then turned, and then maybe that's going to help some of that force go to the other side. You're going to be putting your force on the right and then turning it so that hopefully you get more expansion on the left. Is it going to work? I don't know. Probably not. Is it worth trying? It passes the common sense test.
Right. And yeah, I related to it, man, and I feel the pressure, and it feels like stuff's moving all around here, and I'm seeing the changes, and that really and when she said it was working for patients and it's kind of something she prescribes to her patients, I was like, wow. Um, and I didn't want to bring that up to Dr. Evans just because it did kind of seem kind of woo woo or whatever.
Yeah, and that's the sort of thing that you can talk openly about in Asia, right? Where um, the culture is probably a little bit more open-minded, at least when it comes to medicine and health. In the United States, that sort of thing would certainly be considered more on the woo-woo spectrum.
Yeah,
And to be clear, I just want to distinguish between you pressing on the right cheekbone and turning versus you sticking your fingers anywhere near your appliance and putting forces anywhere on or around the appliance itself. I don't know if you want to mess with that.
interesting. Gotcha. Good to know because I was definitely, feeling it out. And as you mentioned, it sucks with the arms that go out and trying to thumb pull. Not that I was doing a crazy amount, but just like, feeling it out and feeling the differences on the bones. But I'm glad we got to talk about that because that was my main question is that something I should be working into this at all?
I think safely and conservatively from the cheekbone, would be reasonable. But on the whole, man, my general sense, if we're talking as applied to you, FME versus custom MARPE, clearly custom MARPEs can have great outcomes for patients. Like, it's not a black and white thing where FME is going to be amazing and custom MARPE is going to always be suboptimal. It's like you've had thus far a great experience, it seems, cosmetically and functionally. So custom MARPEs can be a fantastic option, obviously.
I'm loving mine so far, man, and I'm your channel is just like it's so fun to go back and forth between the two, and you mentioned and Dr. Manuel mentioned like he treats patients with both. So obviously there's not one that's better than the other, and it's patient specific. And in my situation, I mean, I'm 15 minutes from Dr. Evans' office, so of course I wasn't gonna try to make it work with Dr. Nuaz and driving up to New York and doing that, and there is that price difference. FME
Mm-hmm.
is 20 to 30K, if I'm not mistaken.
That's fair.
Fair
Yeah.
range? Gotcha.
Yeah. Yeah.
So, yeah, that's definitely price was a huge factor for me.
Of course, man.
Yeah,
$10,000 is $10,000. I don't care if you're a millionaire. No one takes $10,000 and puts a lighter to it.
yeah.
It's real money. Whoever you are, 10K is real money.
It's real, man, but I want people to know too, like do your research on channels like yours. And you had Evan on, he has a channel and he actually went through jaw surgery after too, which his story is amazing, honestly. But it's good to have people like that and resources like you to people to deep dive. I watched your channel for probably maybe 2 years or a little bit over that before I felt comfortable making the plunge into MARPE. And it's a huge investment, but do your research, and having a consultation with someone like you really put me in the right place to go through with this and feel confident, and I'm loving the results. I don't feel like I'm wasting my money. I feel like I'm investing in my health and I'm getting a great return on that investment right now.
Well, good for you, man. And thanks for those kind words. Why don't you tell us a little bit about your channel and what your goal is with your channel?
Yeah, yeah, and it's something I've been thinking about myself. Right now, I've been doing, just Markbeat updates. I wanted and you were a bit of an inspiration as well as Evan, just I wanted people to be able to look up Markbeat installation 30 days in or whatever, and kinda be able to follow along, and I'm just one of those people that you can click on and see my experience, and everyone's different, but maybe there's someone who has similar structure as me or had similar symptoms, and I have videos about why I got MARPE. I have a video from day one installation, and I think I'm on 10 or 11 now. Just they're titled MARPE updates, and it's just sit down, talking head video. I go over what's going on. Sometimes I talk about stuff that I found on your channel. I bring up things I notice about myself and just the whole experience in general. So my channel so far is a MARPE update channel. I had a little bit of a flirting with finance in college, so didn't graduate with that degree. I switched, but I have some finance videos just talking about economics and money. But if you're interested in MARPE content, you can go there. There's way more MARPE content than anything else, and just general health. If you guys want to see what I'm doing for my blood work, I just got a function health panel done, which I'm just interested in optimizing my health in general. MARPE is a big part of that right now, but as it goes on and I get my MARPE removed, it's definitely going to shift to just optimizing health in general.
That's great. And by any chance, did you do any kind of blood work before the MARPE so that
I
you can
did.
have a delta before and after?
I did. So the way Function works is you pay an upfront membership. So Function is a blood work company, but they kind of outsource it. So I went to my local lab. Function ordered my test for it was $300 for a year, and in 6 months or a little less than 6 months now, because I got it before my MARPE and it's been a bit, I will get retested. So I'll be able to see, and you get tested in that membership, that flat fee. You get 2 blood tests a year, and you're actually able to track your progress. And what's cool is if I pay for the next year, that's 2 more blood tests, and I can see they map it, they chart it out for you. Personally, I was low in ferritin, which, is low iron stores. That explained a lot with energy, so I started supplementing, and I got to see my hormones, which is something I was curious about, optimizing those supplements I can take, so that's
How's
definitely.
your testosterone?
Side tangent, if you wanna go down it.
Yeah, maybe briefly, just because I gotta go shortly,
Yeah,
but
sorry,
yeah,
sure.
please go
Of
go
course.
take us down it.
It was not trying to be braggadocious, it was almost 1,000, it was probably 940. Um,
Holy shit.
I take and I haven't hit the gym consistently for 2 years, I'm not trying to come off as some manly guy, and I've definitely felt more probably feminine just with all the fucking shit and not working out and my diet, like, I definitely feel the impacts of that, but my testosterone was spiked. I'm on, dutasteride, which is a 5-AR blocker for hair health, so you can and people listening can do their research and take that into consideration and how it affects your hormone profile. Basically, my DHT doesn't get converted into testosterone, so that probably boosted up that number a bit. So I had that high testosterone of about 940 with, a bit of elevated estrogen at 41, nanograms per deciliter. So
Wow.
the balance, it's high testosterone, but the estrogen was elevated too.
Wow. Wow, man.
Yeah.
Um, well, I as soon as you got on the call, I felt mogged
Dude,
by that incredible facial structure.
it's the
Now I
market,
feel
man.
now I feel really mogged, especially because my tea is probably in the dumps being a father of 2 and, you know, marriage and, children are known to tank testosterone.
Those
So,
studies are crazy that you have a kid and you go to dad bod mode and
yeah, I haven't gone to dad bod mode,
you look great,
but
Ron. I will
ah,
say,
man.
man, you look dude, as always, dude, as always.
Well, I appreciate that. It's kind of a forced looking great just because I can't really cheat on my lifestyle at all without falling back into chronic illness. So
Yeah.
it's not because I necessarily want to look fit or want to work out every day or be careful about my diet. It's because I have to because I'm so sensitive with my chronic migraine condition. Although that's very well managed now. Honestly, I cheat quite a bit now, lifestyle wise.
It's been
Uh,
awesome following that because I've suffered with migraines too, and you're someone who talks a lot about them, and it's been amazing following your progress with that, and, that eating tip, not eating before bed has helped me personally, but yeah, keep it up with the migraine updates, dude, and what helps because people like me who suffer with them, I love to hear what other people do.
Thank you so much, man. Yeah, and yeah, I'm looking forward to turning on community features in the joint this weekend and
Awesome,
just
dude.
seeing what type of community conversation we get. I mean, you're a part of that community. You're obviously a remarkable thinker and philosopher
Thank you.
of jaw stuff and of health, which is exactly. I think there's a lot of great thinkers inside of the joint. You being a sort of a case in point. I'm
Thank you.
excited to see how that goes. Yeah, maybe if you could do me a favor, why don't you help kick off community features at some point over the next week? It
Oh, yeah.
doesn't have to be Saturday when I launch, which is tomorrow actually. I don't know when this will be posted, probably sometime in the next couple of days, but yeah, man, give us an update because a lot of members of the joint are facing exactly this question, which is to what extent do I bend over backwards to do FME instead of custom MARPE?
Yeah.
And I just think that your case is it's an argument in favor of maybe you don't have to break your back seeking out an FME if you're uh, if the sensei is 15 minutes away, it could be worth it to give it a shot, right?
Exactly, dude, exactly.
Yeah. Hell
Wow,
yeah.
dude, thank you, man. This was awesome. I can't wait
Uh,
for our next call to check in, dude.
okay, man. Yeah, thank you for supporting my channel in every
Thank you,
possible
man.
way,
Thank
Cannon, and we'll co-post this so anyone who just sort of clicked and didn't realize that Cannon and I collaborated, both our YouTube channels co-posted this video. If you want to check out Cannon's updates, just go right to the video title and you'll see his YouTube channel linked right there. Okay.
thank you, Ron. This was
All
awesome.
right, bro. Have a great weekend, Cannon.
You
Take
as
care,
well,
man.
man. Take it easy.